A Norfolk doctor is receiving national attention for a program aimed to help patients pay for their medical procedures, but not monetarily. Dr. Demetrio Aguila with Healing Hands of Nebraska is the founder of the M25 Program, which allows people to pay for operations with volunteer work to ease the financial strain associated with healthcare. Over the last year, Dr. Aguila's story has been featured on national stations including CNN, NBC, and CBS, and says the most unexpected part of the process has been the number of doctors asking how a similar program could be instituted in their communities.
One of the things that I have found really surprising and overwhelming is the outpouring of support from people all over the world and the inquiries from doctors and nurses and other healthcare professionals who want to know, how can we do this where we live? One of the things that I often get asked is, well, if we had nationalized healthcare, we wouldn't need a program like this, right? Well, I'm not so sure that's necessarily the case, because the people that have reached out to me are people, doctors in particular, from places like Canada, places like the UK and Ireland and other countries where they already have nationalized healthcare. And so if nationalized healthcare were the cure to these concerns, then the question that arises in my mind is, why would those doctors ask me how they can implement programs like this in their country if that need's already being met through the national health system? What I'm really hoping to do is inspire other doctors to think outside the box, to try to find solutions that fit their community, that serve the people in need around where they live.
Dr. Aguila says despite a slight downtick in patients when the COVID-19 pandemic began, more people are utilizing the M25 program for their procedures. And he hopes that he can partner with more nonprofit organizations to give patients more options to volunteer their time.
As we continue to expand and grow, what I'm hoping for is that other charitable organizations can partner with us, other doctors, other physical therapists and nurses and chiropractors can expand their practices, think outside the box, and offer similar solutions to their communities, and so that we can form a network of people that can offer solutions to patients so that they can get the care they need and the excellence that they need without incurring a huge financial burden.
Reporting in Norfolk, this is Alex Loroff, News Channel Nebraska.